Hello and welcome to our special show, Health and Wellness, Myths versus Facts. I'm Priyanshi Sharma. Osteoporosis is a common disease all over the world. Bone loss, a silent process affecting millions of individuals around the globe, is often overlooked. Currently, osteoporosis affects 1 in 5 adults aged 18 to 59 years in India. Osteoporosis that is not treated can lead to serious bone breaks, especially in the hip and spine. Many people think that osteoporosis is simply linked to old age. The older we get, the more chance of having or developing osteoporosis. Well, this is true in some ways. Age isn't the only factor involved, and osteoporosis is linked to various other medical conditions. You'll be surprised to know that even hormonal imbalances can cause osteoporosis. And the good part is that there is a lot more that you can do to protect your bones throughout your life. You're never too young or too old to improve the health of your bones. The cornerstone of the prevention and management of osteoporosis is to improve knowledge and awareness among the general public. Today, we have with us eminent endocrinologists who can help us understand and manage osteoporosis. Dr. Lakshmi Nagendra, who is an assistant professor at the Department of Endocrinology at K.S. Hekde Medical Academy in Mangalore. Dr. Yogesh Yadav, who is a consultant endocrinology at Max Super Speciality Hospital, Dehradun. Dr. Hridish Narayan Chakravarti, who is the DM Endocrinology and Senior Consultant Endocrinologist at Narayana Super Speciality Hospital in Howrah. Thank you very much, doctors, for joining us on this discussion. Dr. Lakshmi Nagendra, my first question to you: what is the role of hormones in our body and how do they really work?
Thank you for that question. So just to start off with a brief overview of what the endocrine system and hormones are actually about. Our endocrine system is made up of several organs called glands. So these glands are present all over our body and create and secrete substances known as hormones. So hormones are chemicals that coordinate different functions by carrying messages through your blood to your organs, skin, muscles, and other tissues. So these signals tell your body what to do and when to do it. Hormones are very integral and affect nearly every function in our body, including metabolism, which is the way we break down food and derive energy, growth and development, emotions and mood, fertility, sleep, blood pressure, and bone health, as we're going to talk about today. So we have the pituitary gland, which is a small-sized gland located at the base of your brain. It's often called the master gland. So now the pituitary gland senses when your hormone levels raise inappropriately and tells other glands to stop producing hormones or produce lesser hormones. And when the hormones dip beyond a certain point, the pituitary gland tells the other glands to produce and release more hormones. So this process is called homeostasis, which is similar to maybe a thermostat in your house. So when your hormones are balanced and are working in sync, you won't notice them, which is a good thing. But when they're imbalanced, you could start seeing cascading health issues take over. So hormonal imbalance stems from our body making too little hormones or too many hormones. So for example, insulin is a hormone which is secreted from the pancreas. Insulin prompts our body to absorb blood sugar for energy and storage. So lack of insulin production or defects in insulin action can lead to various forms of diabetes. So to sum it up, hormones are chemical messengers that control, coordinate, and regulate almost all the essential functions of our body.
Right. If I can take my next question to Dr. Yadav, the prevalence of osteoporosis is increasing every day. What are some of the common and more prevalent causes of osteoporosis?
There are multiple causes of osteoporosis. The most common, I would say, is estrogen deficiency at the time of menopause in women. So at the time of menopause, there is sudden decrease in estrogen hormone, which leads to rapid bone loss, leading to osteoporosis. Then, in case of poor nutritional intake, poor vitamin D intake, calcium intake is poor. In those cases also, there is high risk of osteoporosis. If a patient doesn't exercise, so sedentary lifestyle, patient is having a sedentary lifestyle, those are also at a higher risk of having osteoporosis. Then there is increased risk of osteoporosis in lean persons who are underweight. they have a higher risk of developing osteoporosis. Then with increasing age, there is ongoing bone loss at a certain rate. So as we know, the life expectancy is on a rise. Life expectancy is increasing. So with increasing age, there are higher chances of having osteoporosis. So we are seeing more number of osteoporotic fractures actually in elderly patients. Then there is increased risk with smoking, with alcohol intake also, and now with recent corona epidemic, have been significant use of steroids, and steroids have been used for multiple other clinical conditions as well. So if steroid intake is for a longer duration or it is in a higher dose, that can also lead to osteoporosis. Most common cause, I would say, is postmenopausal women because of estrogen hormone deficiency.
Right. My next question to you, Dr. Chakravarti, while osteoporosis is most common in older people, it sometimes affects young people as well. Why does it really occur in young adults?
The myth is actually that osteoporosis is a disease of old age. But what we need to remember is that it can also occur in the young population, the adolescents, and especially in the most productive age group, that is 30 to 50. So they are relatively young people who are getting crippled by this disease. Now, what we need to understand, when this occurs at a younger age of onset, certain diseases have to be considered in particular. Dr. Yogesh had just mentioned, I would just draw an extension to what he said, that rampant use of steroids, what we saw during the corona pandemic, that causes rapid bone loss, and we saw a lot of people in young patients who suffered because of corona recovered, but because the steroid had been given, they landed up in osteoporosis. The other endocrine issues which concerns me as well as the other panelists being endocrinologists is that there are some other disorders of glands, as Dr. Lakshmi was mentioning, that we can have diseases in thyroid like hyperthyroidism when the thyroid gland is functioning more, releasing more hormones. In those circumstances, osteoporosis may occur. Then parathyroid diseases, that's also a small 4 sets of glands in the neck. They can release hormones which is normally the parathyroid hormone. When released in normal quantities, doesn't cause any problems. But as she said, when there is an imbalance, the homeostasis is disturbed. In those circumstances, that can lead to osteoporosis. Other issues may be like sex hormone deficiency, be it in males when testosterone is less, be it in females, as Dr. Yadav was mentioning, in the postmenopausal state, and even premenopausal when ladies are having premature menopause. In those circumstances, this can be a problem. Other issues may be like vitamin D deficiency and also type 1 diabetes, in which insulin is required for survival, which occurs in young population. When they are having long-standing type 1 diabetes, that can also lead to this. Other issues which are of concern obviously are some blood cancers or leukemias, and the treatment of those conditions by various drugs, they can also cause. Another important thing I need to mention is use of long-term heparin, anticoagulants, and some other drugs. They can also lead to osteoporosis. And being an endocrinologist, I must mention there are some anti-diabetic agents as well, like we mentioned pioglitazone. If they are not judiciously used, can lead to osteoporosis. So these, in summary, tell us the causes of young osteoporosis.
Right. Dr. Nagendra, if I can come back to you now. Osteoporosis can be serious and fractures can impair one's quality of life severely. Are there any warning signs that one can look out for before the start of osteoporosis?
You're right, osteoporosis is indeed serious and fractures can be very debilitating. But unfortunately, one of the most troubling parts about osteoporosis is that it's a silent disease in its early stages. You may not realize you have the condition until you suffer from a bone fracture. So you may be experiencing bone loss slowly over time without any indication that it's happening. So once bone mass has deteriorated further, you may start to experience more obvious symptoms such as loss of height. So compression fractures in the spine can cause a person to become shorter. This is one of the most noticeable symptoms of osteoporosis. So you could be experiencing back or neck pain also. This is again due to compression fractures of the spine. So these fractures can be very painful because of the fracture itself, or it could be because of the collapsed vertebra pinching on the nerve that radiates from the spine. So this pain can range from minor tenderness to severe debilitating pain. So don't ignore that back pain if you have, and you should get evaluated for it. Osteoporosis again can cause a stoop posture or fracture because again of the compression of the vertebra, which may cause slight curving of the upper back. What we call as kyphosis. So this can again cause back and neck pain, and it can also affect breathing due to the extra pressure on the airway and expansion of your lungs. And of course, fractures are the most debilitating symptoms of osteoporosis. It could cause a variety of fractures apart from the vertebral fractures that I mentioned. But fractures resulting from osteoporosis are what we call as fragility fractures. So these fractures different from fractures that you could have maybe in a road traffic accident, because osteoporosis causes fractures from trivial trauma. Fractures can occur with fall from a standing height or from a simple slip in the bathroom, or sometimes osteoporosis fractures can be triggered by no trauma at all. So unfortunately, there are no warning signs of osteoporosis, and patients are symptomatic only when they have advanced disease and a fracture, which makes it very, very important to screen for osteoporosis.
Right, that's very important to note. Now, Dr. Yadav, why are women at a greater risk for osteoporosis as compared with men?
Okay, so women are at increased risk. One point again, I would again highlight that they develop estrogen deficiency, sudden estrogen deficiency at the time of menopause, which leads to a very rapid bone loss. So if we see, there is ongoing bone loss. Let's say it is around 0.3, 0.5% per year. But at the time of menopause, women, they have a rapid bone loss up to the rate of 3% per year in the spine. So they are losing bone very quickly at that time. So they lose a lot of their bone density within the next 5 to 10 years. And that lends them up in osteoporosis at a later age. Also, there are higher chances of more commonly seen vitamin D deficiency and poor calcium intake in women, more commonly seen in women compared to men. That also puts them at a higher risk of osteoporosis. Then they have a lower bone density to start with because of their shorter body frame. They have a lower bone density compared to men to start with, and hence they are at a higher risk. And similar to menopause, there is no equivalent, no exact equivalent in men. So the men, they don't lose their male hormones or testosterone suddenly. It may decrease with age, but it is not lost at a single time. So all these factors, they put women at a higher risk. Also, women as such, they have a significant family history also of osteoporosis. So that also puts them at a higher risk. So all these put together, they make women more susceptible to osteoporosis.
Right, we'll just take a short break now, but we'll continue with this discussion with our experts on the other side. Stay tuned. Welcome back to our special show, Health and Wellness, Myths versus Facts. Today we're focusing on osteoporosis with eminent doctors. Dr. Chakravarti, if I can take my question to you, at what age should one go for a regular bone density test? What are the tests that are available to diagnose osteoporosis?
So I would go to the second part of your question first, that what are the tests available? The most important screening test for osteoporosis will be a bone density test. It is done by DXA scan. The bone density, though the name is density, which means 3-dimension, but basically it gives an areal density of the bone. With this, we take some images of the hip, spine, and some other regions of the body if required. And according to that, there are some scores built up like T-score, Z-score. Regarding T-score, we categorize the patient as whether they are in the normal zone, in the borderline zone, that is osteopenia zone, or in osteoporotic zone and severe osteoporotic zone. So depending on the T-score, we can actually stamp or label them in which categories they are fitting in. The most important thing to note about this is that this test should be done in the same machine every time, preferably. Other tests available are the QCT, that is the quantitative CT scan, and then bone biopsies are also there, but usually we do not require it because it is an invasive test, and we have some non-invasive good tests available in our armamentarium. Some biochemical tests are also there, but they are not used very rampantly. And as I had mentioned earlier in the previous question, that young osteoporosis patients, they can have a variety of causes for their osteoporosis. So that underlying condition also needs to be investigated. Suppose the parathyroid hormone is raised, that means the parathyroid gland is hyperfunctioning. If the free T4 is raised and TSH is suppressed, it means the thyroid gland is overfunctioning. And in case of type 1 diabetes, obviously the sugars have to be checked well. We have to also see whether vitamin D is deficient or not. So these are the tests available. And regarding the first part of the question, that at what age regular BMD should be done, the thing to be remembered is that though it's a chronic disease, it is not like diabetes or thyroid or some other where we go for a preemptive testing. When the doctor thinks that BMD has to be done, usually it is done once, and then for follow-up it is done at 2 years. But your doctor can actually specify whether this interval can be prolonged, say at 3 or 4 years intervals it is required, or it can be done a little bit earlier as well if the situation so demands. So it will be entirely the discretion of the treating endocrinologist.
Right. Dr. Nagendra, now what steps can one take to reduce the risk of osteoporosis during menopause?
So there are a number of things that we can do. But the first step would be knowing your risk of osteoporosis. So now Dr. Chakravarti has already alluded to the bone mineral density test, which is of course the gold standard for the diagnosis of osteoporosis. But I would like to tell you that we have come up with something known as practice-based treatment guidelines, which we published last year in the Outsiders of Osteoporosis. So this takes into account the various risk factors that a person has for osteoporosis and computes the 10-year probability of a fracture. And in resource-poor settings in India where the access to bone mineral density by DEXA is not available, we can use this tool and start the patient on treatment or refer for BMD testing, even in the absence of a bone mineral density test. So we should use this as a screening test to evaluate the risk of osteoporosis and a 10-year probability of fracture. So another thing that we could do to prevent osteoporosis is exercise, particularly weight-bearing exercises like walking, and also a balance training, which can help prevent falls, which is a leading cause of fractures. The third thing would be look at your calcium and vitamin D intake. Make sure you're getting enough calcium and vitamin D. Most adults need calcium about 1,000 to 1,000 milligrams per day, depending on age. And vitamin D is also important for bone health. And people who do not receive adequate amount of these nutrients through their diet may benefit from supplementation if advised by your doctor. And of course, stopping smoking and limiting alcohol consumption is necessary for overall good health, including bone health. And in women having premature menopause, that is menopause before the age of 40 years, hormone supplementation with estrogen and plus or minus progesterone may benefit a subset of patients and reduce the risk of osteoporosis. And most importantly, if you've already had a fracture, it is important to treat for the cause of the fracture and not fracture result. So if you've had a fracture and you're operated for it, the treatment does not end there. You should be evaluated if you've had any secondary causes that could have led to this fracture, and treatment of the cause is very important to prevent future fractures.
Right, important advice there. Now, Dr. Yadav, how does a person know if osteoporosis is due to hormonal imbalance? Are there any tests that need to be performed?
So there can be multiple hormonal issues that can land a person into osteoporosis. So one, as Dr. Lakshmi just mentioned, is early menopause or premature menopause. So if a woman she doesn't have periods for, let's say, around 6 months, then before the age of 40 years, then she should meet a gynecologist first, obviously. But then she can be investigated further, and if required, she can be started on treatment so as to avoid osteoporosis. So one is related to estrogen deficiency. Apart from that, there can be hyperthyroidism. So overactive thyroid gland, which produces more thyroid hormones. This can also lead to bone loss and later on osteoporosis. The patient has symptoms of weight loss, excessive sweating, palpitations, tremors. So in that case, if a person has these symptoms, then he or she should get himself checked. It can be easily detected by doing a simple blood test of thyroid profile. Then there is a condition called as hyperparathyroidism, where parathyroid hormone is increased, is excessively secreted. It leads to loss of calcium from the bones and decreases bone density. The patient may present with frequent kidney stones. So if there is such a person, and he or she get himself checked, blood test can be done. Calcium, phosphorus, parathyroid hormones, these are simple blood tests which can detect this condition. Then there can be a condition of Cushing's syndrome, which is excess of steroid hormones in the body. So it can be steroid hormone may be increased from within the body, or it may have been given from outside the body for maybe for some treatment purpose, or as we discussed, many persons they received steroids for COVID. So that can also lead to osteoporosis, and this can again be investigated and easily managed by an endocrinologist.
Right, so
Apart
lots
from
of
that,
important...
there may be diabetes also.
Right, lots of important advisories and warnings there from our doctors. Thanks very much, doctors, for joining us on this discussion. With that, it's a wrap on this show. Thank you for watching. We hope this answered some of your questions on osteoporosis.